Glycoprotein defect diseases. So continuing, we'll be looking at the oligosaccharides. So oligosaccharides is basically there's lack oligosaccharide doses. Okay, so there is lack of the specific, that is the lysosomal hydroxylase for the glycoproteins. Now the defect of oligosaccharidosis is there is the intellectual as well as the physical developmental delay. Next, there is also presence of seizures. There is joint stiffness. There is also problems with the vision, hearing. There can be presence of anemia. There is nosebleed, and there can be bruising and swollen abdomen. Swollen abdomen is basically due to and enlarged spleen as well as the liver. Next, the defect is the congenital disorders of the glycoxylation. So there is something known as congenital disorder of the glycoxylation, and this is nothing but the defect is in the glycoxylation of variety of tissue proteins. So this defect in the glycoxylation of a variety of tissue proteins, and there is also lipid or lipids is deficient. Is deficient or defective. Then now looking further, there is also the features include the fatal is malfunction, and this is of different organs system. Next, we are looking at the FTC. FTC is nothing but the familial tumor calcinosis. It's also known as FTC. FTC is a defect in the UDP, GAINAC, the transferase 3, and the clinical features, it involves the calcium deposits in the skin as well as the subcutaneous tissue. Now there is also an unresponsiveness, and this is to the parathyroid hormone. Next, we are going to look at the WWS, also known as the Walker-Warburg syndrome. So Walker-Warburg syndrome is a defect in the alpha dystroglycan for dystroglycan, and the clinical features involves the agenesis of the corpus callosum. There is also the anal atresia. There is the atresia of the external auditory canal, and there is blindness. There is ophthalmos. There is presence of cerebral dysplasia as well as cleft of the upper lip. Next, looking at the hereditary erythroblastic multinuclearity. This is with the positive acidified lysis test. So in short, it is known as the HEMPAS. So this is nothing but a defect in the alpha mannosidease 2. And the clinical features involves the ineffective erythropoiesis. There is hemolysis as well as the erythroblast. Morphological abnormalities. There is also the hypoerythrosis glyoxylation. This is of RBC membrane proteins.